Welcome everybody to our final webinar of the Year of Children's Vision Screening, Bridging the Gap Between Vision Screening Referrals and Confirmatory Eye Examinations. I want to just give a few thank yous, and then I will introduce Prevent Blindness and our National Center for Children's Vision and Eye Health, and then introduce our speakers and turn it over to Dr. Kay Nottingham Chaplin. I'm Donna Fishman. I'm the director of the National Center for Children's Vision and Eye Health at Prevent Blindness, and we're so happy to see you. We've had more people register for this webinar than any webinar we posted, so we know this is a topic that's very relevant. It builds on the webinar that we had in August on vision screening, and we will be sending you follow-up information, and we'll send you the link to that video in case that recording, in case you missed it. I wanted to just thank you all for being here, and thank you for all the work you do every day to make sure children have their best vision and make sure they get to eye care and get treatment when they need it. And we know that because we ask you after every webinar and in surveys what your challenges are. And today we're going to really be delving into what some of the challenges are and then some of the solutions. So we're really excited. I want to especially first, of course, thank Dr. Kay Nottingham Chaplin as our lead presenter and the content. Kay has been working for years, many years, pulling together this kind of information. There'll be more products coming out. And I want to just give a special thank you to our intern from last year from George Mason University, Aaron Brown, who was fabulous in helping Kay pull together some of the challenges and the things that you will, and some of the solutions, the things you'll see. I want to give another call out quickly to our marketing communications team to make sure that you know that our Zuba Laser created this great graphic of this bridge with Aaron's help, and then our great communications team making sure that you all heard about this webinar. So thank you for all that. It appears our chat is disabled, and I'm sorry about that, but we'll be using the Q&A function for today. So just a couple short housekeeping. Please do place your questions in the Q&A box, and we will hopefully get to some of those by the end. As I said, I'm recording the session. We'll be sending out the link. If you would like a certificate of attendance, it's not for specific professions, CMEs or anything, but you can get a certificate of attendance that you can submit yourself. And I just quickly like to introduce Prevent Blindness and the National Center for Children's Vision and Eye Health. At Prevent Blindness, our mission is to very simply to prevent blindness and preserve sight. And we work on a continuum all the way from a vision, from observing if children might have, and adults, but children might have an issue based on the appearance of their eyes, all the way through the vision screening, getting eye care, getting treatment, and a lot of what's included in that is communication and engagement with families, and you're going to hear a lot about that today. So Prevent Blindness, we promote evidence and science. You can see here, we create resources, we education and training, which you're getting today. We run several awareness campaigns, and we work on policy and systems change to make sure that our kids get everything they need to be healthy and successful and happy. So our presenters today, Dr. Kay Nottingham Chaplin is the Education and Outreach Coordinator for Prevent Blindness and the National Center for Children's Vision and Eye Health. She provides our technical assistance throughout the United States to at least 2/3 of the states each year someone calls from. And she runs our very successful Prevent Blindness Children's Vision Screening Certification course. She has worked in this field for over 21 years, has presented at about 250 conferences and training sessions, and is very heavily published. So you can Google her and look up her name and look in PubMed and see all the great articles that she's written specifically on vision screening. She created our vision screening by age page on our website, as well as our small steps for big vision toolkit for eye health education for families and caregivers. Tasha Lockridge is the manager of eye health services at Prevent Blindness. We're happy to have her here today. She has worked here for 17 years. She manages 2 national voucher programs and has started a 3rd one. She works with communities. Our Our voucher programs help families receive low-cost or free vision care in the United States, and eyeglasses, of course. Our programs serve 10,000 individuals annually to get eye exams and eyeglasses. So we thank Tasha and Jessica Holden. Jessica Holden is the Health Services Manager at the Amador Tuolumne, and I hope I said that right, Community Action Agency, their Head Start in California. And we're really excited to have her here to talk about some of her personal experiences. She's worked in early childhood education for 18 years and at Head Start for 11 years. She develops, implements, and updates program plans related to health, dental health, safety, and nutrition. And she assures all children receive the required screenings and get to the health care that they need. Okay, so I'm going to stop sharing and take it away, Dr. K.
Okay, hello everybody, and thank you for joining us, and hello to those of you who will be watching us later. So thank you again. Today we're talking about bridging the gap between vision screening, excuse me, between vision screening referrals and confirmatory eye exams. And let me see. So I just want to show our image again, our graphic that we're using. So this will be part of our Small Steps program. So on this side, you see a child, she's squinting, she's having a little trouble seeing. And on this side of bridging the gap, you see two children wearing glasses. This child perhaps is just being monitored, or maybe does not need any treatment at this moment in time, but again, will be monitored just to keep an eye on the reason for referral. Now you'll notice on this bridge, these different blocks. These represent the common barriers and cultural beliefs that sometimes occur between children on this side of the bridge and children on this side of the bridge. So as Donna mentioned, this is a continuation from our August 16th webinar, where we talked about evidence-based vision screening tools and best practice procedures. So this is part 2. And this is the link. And don't worry about taking notes, because we will send, in addition to the information that Anne sends you, we will also send a PDF so you can get to these links. So today, again, we're discussing bridging that gap between the vision screening referral and the confirmatory eye examination for either treatment or monitoring and ongoing care. As we all know, in an ideal world, all children referred for an eye exam would receive the eye exam and treatment or monitoring and ongoing care. And our overarching goal is to reduce the gap, not reduce it 100%. That may not happen. We need to be realistic, but at least to reduce the gap by working with families to learn about and help resolve their individual common barriers and cultural beliefs. So 3 learning objectives for you today. That one, you'll, at the end of our time together, you will be able to describe 3 common barriers to scheduling and attending an eye exam after receiving a referral from a vision screening. That you will be able to describe 3 strategies to help overcome barriers to eye care, and that you'll be able to list, I've got to get rid of this little guy, that you will be able to list 1 financial resource that will cover the cost of an annual eye exam and a pair of prescription glasses, and 1 financial resource for undocumented families. So we also are hoping for interaction and definitely learning from each other. So we hope to be able to have time at the end to answer your questions and for you to describe your common barriers and cultural beliefs that are not discussed today and how you worked with families to overcome those barriers and beliefs and achieve the eye exam and treatment monitoring. Now, if we don't have time to get to this, there is a question, I believe it's question 5, the evaluation that will give you this opportunity. So just to set the scene here, give you a little bit of context. How is clear vision helpful for children? Overall childhood development, education, and helping children achieve their best academic performance possible. Children's self-esteem and confidence, improved classroom behaviors, because as I mentioned in August, sometimes we don't think about vision as part of behaviors. Future employability and lifelong independence. Some academic considerations: improved GPA, particularly in reading and math, more likely for hyperopes than myopes, increased satisfaction with school, reduced stress, can't we all use that? Improved cognition, attention span, and focus, improved test scores, less avoidance and need for discipline, less labeling, ADD or ADHD, when it may just be vision, and it may also be a component of learning disabilities to be ruled out. Earlier identification leads to improved outcomes. So why do we want to resolve these barriers to treatment? And please don't ding me for reading from slides. This is just some very important information that I want to make sure gets across. And then when you receive your PDF, you'll have full sentences and not just bullets. So a failed vision screening without a follow-up confirmatory eye exam, treatment, and on monitoring and ongoing vision care is not a complete vision screening. So vision screening doesn't end with just saying we screen X number of children. It's a spectrum. Undetected and untreated vision disorders may be difficult to treat, may lead to worsening, may even lead to permanent vision loss, may impact learning, again, reaching the child's academic potential, if not treated early, preferably before age 7. And one letter or one phone call after a vision screening that a child did not pass may not be enough for all families to ensure that the eye exam occurs. Whoops. So the pathway from vision screening referral to eye exam in an ideal world would be the child receives vision screening and a referral for an eye exam if the child does not pass vision screening. The parents schedule and take their child for an eye exam when their children receive this vision screening referral, and the child attends the eye exam, receives treatment or monitoring, and continues ongoing care so that 4 or 5 years later, they're not wearing the same prescription in their eyeglasses. So we have some misconceptions. As vision screeners, we often think that parents and caregivers are going to automatically follow this ideal pathway from receiving the vision screening referral to scheduling the eye exam, to taking their children for the eye exam, to receiving treatment, which again may be monitoring, and ongoing vision care. We may not always consider the level of knowledge that parents, caregivers have about vision and eye health. We may not always consider how they feel about their children wearing glasses, or we may not always consider the other barriers and cultural beliefs related to the follow-up eye exam and ongoing vision and eye care. And we also may not always think about what parents need time to wrap their head around this. And I'll not digress into a story I'll get us off base. So a breakdown in this ideal world pathway often happens at this step, where the parents schedule and take their child for the eye exam after their children receive a vision screening referral. So we wanted to look at the rate of confirmatory eye exams, and it's difficult to know this for certain because we lack database to collect a lot of this information, although that may be changing. But from this one study, approximately 5 to 50% of children receive an eye exam. So that means 95 to 50% do not. So we want to find the why the breakdown occurs. One thing, please do not call families non-compliant. Dig deeper to find the why. Look at common barriers and cultural beliefs and work with the families to address those barriers and beliefs. So dig deeper. Hope I got a chuckle there. So now I want to give you just 5 examples of cultural beliefs, and I have 80 plus studies. So, and plus what you guys have shared with me during our virtual skills assessments and during other webinars. So, home treatment could be a cultural belief. Here's an example. The simple things, for example, a child with eye inflammation are treated at home without consulting a doctor. We go to the pharmacy and we take eye drop or eye ointment, and we use the traditional treatment. For instance, boiling salt water and using this as eye drops and tea water, as well as, and this was in the quote, so I think it's chili. In the case of the child who has poor eyesight, we use the razor blade and sharply cut both sides of the child's eyes, and the blood from the wound is wiped in their child's eyes and is said to improve the child's vision. Another example has to do with perceptions about certain vision disorders. Some parents are aware that eyes should be aligned while looking straight and that misalignment is a vision disorder, while other parents consider the misalignment as a sign of good luck. Or the child is too young to have vision problems. And I hear this a lot, particularly in Head Start. So eye problems happen to adults after the eyes get older. These are some beliefs. Children's eyes are new and should therefore not have any problems yet. But since they are children, they don't suffer from any eye problems, not like us that are older. And it's like a new car. As you use it more, it starts to have more wear on it. So a child is completely healthy, like this new car. Then when they've driven the car many, many years, it's like the grandparents who now need glasses. Mistrusting school nurses and mistrusting health in general, health services in general, but some of these spoke specifically to school nurses. So vision problem is not considered a priority, a belief that screening results were inaccurate, the examination is not needed, and mistrust of the school nurse. And for you school nurses, I'm sorry. Families don't believe their children needed a professional exam. They were aware that their children failed they were unaware that their children failed the vision exam, and that would be screening, because sometimes not knowing the difference between a screen and exam can be problematic. Parents thought their children intentionally failed the test to get attention. They did not believe the screening result, the parents, and parents believe that school screening instruments are inaccurate and not trusting the school nurse and so forth. Then a fifth one involves religious belief system. Religious or cultural belief system did not allow for curative or supportive treatment. Quote, both cultural and religious beliefs can affect whether parents seek medical attention, consent for traditional treatment, or attempt to refuse or limit traditional health care. And more than 30 churches identified in the literature have doctrines, religious frameworks, or teachings that include the limitation of, refusal, or preference for prayer over traditional medical interventions. So now we're moving on to 10 examples of common barriers. Lack of transportation or long travel time that may include an overnight stay. So in some states, they have to travel by ferry, or they have to travel by airplane, or even helicopter to the nearest eye doctor, and that's going to require an overnight stay. All adults in the household work, and jobs do not provide time off, or adults encounter problems taking time off from work and no convenient time to go to the eye doctor. There may be situations where if families take time off from work, they may not have a job remaining for them to return to. And here's a quote: you have to ask permission at work, and it's hard to get. Lack of insurance, or the provider does not accept the insurance the family has. Again, these are incredibly common. They cannot afford the copay if they do have insurance, or the amount goes toward the deductible and they still have to pay this out of pocket. This is from a family who she said, I can't afford to pay copays or prescriptions when all I have is $200 child support for rent, gas, diapers, and anything else I need for my apartment, like dish soap or toilet paper. Lack of money, time, that would be lack of time, no transportation, non-English speaking families, fear of outsiders, and many of our students live in households where the parents can't read or write. And lack of knowledge about vision health and importance of good vision for learning. So we're going to address 5 and 6, and then we will turn back to the remainder of the 10 examples. So now I turn it over to Tasha to talk about the lack of money barrier.
Thank you, Kay. I appreciate the introduction, and thanks to everyone for joining us today. So we have already discussed some of the challenges that can happen when trying to achieve care to achieving, when we're trying to achieve getting care, vision care in particular. And so what we're going to do today is take a deeper dive into the lack of money barrier. And so the goal of Prevent Blindness, along with its sponsors, is to reduce the incident of unnecessary vision loss and impairment by providing access to a donated comprehensive eye exam and eyeglasses for the uninsured and the underinsured individuals in the United States. So we do have 2 programs that we'll be talking about later, and how these programs work is that Prevent Blindness will partner with an organization or agency to identify adults and children in need of eye care services, but without the means to obtain their services on their own. Also, within those financial assistance programs, we do have an income eligibility criteria. So these families have to be at least have income at least below the current 200% poverty level, and they must not have any benefits through Medicaid, Medicare, or any private insurance. And so the private insurance would basically kind of include any vision care through your work, employer, something like that. The next slide, please. So we were talking about the two financial assistance programs, and one of these programs is our Eyes of Hope program through VSP. Many of you may have heard of VSP. It's called the Vision Service Plan, and they do sponsor this particular program. And again, it is a gift certificate program that we can qualify adults and children for exams and glasses. They also have a program where you can have a prescription already and only need glasses. Also, the income eligibility is the same. The family must be under the 2%, the 200% poverty level. And also just to note, the federal poverty guidelines are online, so you can look those up as needed. One of the other points is that you can use this program yearly. So just like any other program, when you have insurance and you need insurance, you need to have an exam. You can get the same exam through VSP every 12 months. And again, with the no vision care coverage through a private insurer or a Medicaid program, which would be a government program. And it can be used at the gift certificate can be used at any local VSP provider. And that information is also given on the website. We can get that information to you about what provider to use and receive services. Next slide, please. So the other financial assistance program would be our One Sight program. And so our One Sight program is similar to VSP in that it does provide a pair of glasses. However, you would already have to have your prescription. The prescription cannot be more than one year old. And also the same eligibility requirements are available. It's federal poverty guidelines, 200% and under. So there are a few questions that I'm aware that many people ask. I know I get them a lot as well. So I'm going to try to touch on as many as I can in this statement. The first question would be the financial assistance resource most helpful to Head Start and preschool and school age families. So this would be VSP and One Sight. VSP can cover any vision care, most vision care services. And in other ways, they will also cover a pair of glasses as long as you have a prescription when you go into the provider. So that's similar to One Sight as well. As long as you have a current prescription that's not more than 1 year old, you can use these services. The other question is financial assistance for one eye exam and one set of glasses a year. How is this provided? So that's when I would come in. I can be reached at Prevent Blindness, and we can get you started with an application so that we can determine your eligibility. Once your eligibility has been determined, we can send out a gift certificate or a referral card to get you a pair of an exam, most importantly, and then your pair of glasses. I can be reached at the toll-free number that's listed, or I can be reached via info@preventblindness.org to get you started with that information. The next question is financial assistance for undocumented families. I get this question quite often. So the great aspect of all of our programs at Prevent Blindness is that we do not require any documentation, Social Security's numbers, anything like that. So that's a great way to be able to help every family that is in need. The other question is financial assistance to help families financial assistance to help families receive replacement glasses for broken glasses. So that is what our One Sight program comes in. A lot of times with children, they'll get their exam, say for instance, through Medicaid. And Medicaid will give them one pair of glasses, and they may not replace the glasses if they've been broken, especially within the year. So this is where our one-site program will come in. As long as the prescription is recent, we are able to give you a referral card that you can use at a local Target or Target Optical or Lens Crafters. And they will be able to get the child a new pair of glasses based on the prescription, as long as it is not more than a year old. So again, with our programs, it's the Vision Service Plan. It's called the Eyes of Hope Gift Certificate Program, and it will provide an eye exam and a pair of glasses as long as you're eligible. The other program is the one-site program, and that assists clients with getting glasses. That assists clients with getting current eyeglass prescriptions with quality eyewear. And you can get all that information on our website as it's listed. And again, I'm Tasha at Prevent Blindness, and that's the toll-free number I can be reached at, or the email address that you can reach out to. Next slide. So we have so many families that we reach out to. We are a national organization, so we try to touch as many families as we can. And oftentimes these individuals will reach out and give us some success stories that we're able to share, and we're very proud of them. So here's a success story with Susan. Susan is 2.5. We noticed that she was having a hard time seeing. So we got her eyes checked, and her eyesight was pretty bad. She had her glasses for 3 days, and we can really tell the difference in her. Thank you for helping us to make it possible for her to see. So that's from one of our parents that had used from our Ohio affiliate that used our program, and we were able to get the child a pair of glasses so they can have a better quality of life. And we have another success story. So again, our financial assistance programs have assisted thousands of people across the country. A lot of these families have reached out to us via email, and they sent us thank you cards with gratitudes of expression. I did have a parent contact me regarding assistance for her child. And with the whole COVID experience, a lot of people lost their jobs during that time, and her work-related insurance was disrupted, and she lost her job. She didn't have her insurance anymore. And so her daughter had broken her glasses, and they were relatively new. She got the glasses with her work insurance. So she was very happy to get in touch with Prevent Blindness via a web search. So that's another way we can be reached, info@preventblindness.org, and just a general search. So we chatted a little bit about her situation. She did apply for our program, and she was approved for the one-site program. As I mentioned before, our one-site program assists those who break their glasses or lose them, as long as their prescription is not more than 1 year old. So again, this was because her daughter already had the newer prescription, and she was able to get a new pair from Lens Crafters. So that's one of the great stories that comes out of these programs. We're able to assist those who are kind of in a gap situation where they do have lack of money, or just lack of access at that time. So we're always happy to help. Next slide.
Okay. Thank you, Tasha. That
Thank
was
you.
awesome. And I apologize for the trouble with the slides, with the moving them.
Okay.
So we'll see if we can do better, but great job. Thank you. That was excellent information.
Thank you.
So for the lack of knowledge barrier, we created small steps for big vision. These just a few examples in English and Spanish of the documents that are available, like the association between vision and learning, vision and classroom behaviors, difference between vision screening and eye exam, the importance of the eye exam, 10 steps from moving through the vision screening to the eye exam, how to schedule an eye exam, and the financial assistance that Tasha just talked about. So moving back to the examples, 7th one here, I have glasses are cosmetically unappealing for females. Social stigma. This is a quote from one of the papers. Social stigma regarding the wearing of glasses was more often stated by parents having a girl child, as they felt it is cosmetically unappealing. Language barriers, that's a huge barrier. Parents said the doctors talk to you in English and we don't understand, and that's why we don't go. Glasses, sometimes the thought is that glasses will equal stigma and bullying. Quote here from a parent: wearing glasses is something that everybody else sees, so it is a problem for potential stigma or bullying. And scheduling challenges, not knowing how to schedule an eye exam, for example. So for that barrier, we created this document, How to Schedule an Eye Exam. Gives links to ophthalmologists and optometrists, how to make the eye exam appointment, questions to ask the eye doctor, and it also includes how to prepare for the visit. There are a couple of videos here. The first one, these videos show what will happen at an eye exam, and this first one, you can go to the closed captions and select any language that is needed for that particular family. And also, it's a good idea, I think I need my glasses on now. It's a good idea to take a snack, take a storybook, take a toy for an eye exam. I know when my granddaughter, who will be 4 on Halloween, had her eye exam, we took Turquoise, the blue teddy bear. And when she was in the exam or the waiting area after her dilation drops and returned to the eye exam room, we forgot Turquoise. So I was frantically running around the exam room, found Turquoise, and the eye doctor and the technician both did their work on Turquoise before my granddaughter. And so that's just, I learned the incredibly important piece of making sure you have something for the child. So here are some tips for attempting overcoming barriers and beliefs. And again, you guys probably have your own, and we would like to hear those. These are just some we want to share with you. So determine how the family wants the vision screening results. Do they want it do they want to know in person? Do they want them in writing? Do they want to call you, for you to call them and tell them verbally? Do they want text messages? And Jessica, who's speaking next, says that a lot of her families are preferring text messages. Do they want email? And in what language? So maybe just not automatically sending a letter, but finding out how they want to be, how families want contacted. Another quote from a study, the eye doctors stated other family members, especially the in-laws in a joint family, act as barriers by stating their difference of opinions, creating doubts regarding the child's need for medical care. And sometimes all of this confuses the parents and they won't allow them to seek care. Or in one parent said that the husband not allowing the wife to take, actually, I think this is from an eye doctor, sorry about that. Husband not allowing the wife to take the baby to consultation. The in-laws don't allow the mothers to bring the child in, and mama is scared that she will be blamed if the child does have a vision problem. So the tip here is, in multi-generational households, determine who is the individual and family who makes the medical decisions for the family, and talk with that individual. This is rather long, so you can look at it in more detail. when you receive your PDF, but this is just collecting, call local eye doctors in your area, and that may be 3 hours away, and collected the name, the practice name, the website address, the physical address, telephone number, the hours open for business, etc., and so on. I won't read all of these, but whether or not interpreters are provided, and whether or not the eye doctor examines and treats young children, very important. Whether or not the eye doctor treats children with special health care needs, and infants and toddlers, and if not, if they could tell you someone who could, and then assign a staff or a volunteer to update that list every 6 months and include the revised date on the document to ensure families receive the most up-to-date list. 2 questions to ask parents when taking that deeper dive into the why eye exams are not scheduled is, how would you feel if your child needed to wear glasses? Some families, they just have to get their heads around. I know my son wanted to know what occurred at the eye exam, and I'm trying to explain the 5 diopters of hyperopia and the esotropic strabismus, and he was just like, stop, I need to get around the fact that my kid has a problem. My kid is going to need glasses. My kid, this may affect her employment. And then the next morning, he says to me, okay, I've processed this and I'm now ready to listen. So he was okay with her wearing glasses. He just had to wrap his head around the idea that she needed to wear glasses. So we need to take that into consideration. For some of us, we've made referrals hundreds and hundreds and hundreds of times, and we need to remember that for that family, this may be the first time that family has heard that their child may have a vision problem and may need glasses or may need some other treatment. So we need to be gentle and meet families where they are and understand that they may need time to process this information. Another question is, what needs to happen for you to take your child for an eye exam, and how can I support you or our program? But how can we support you? It's incredibly important. So it's important to remember also that we have all these categories of common barriers and cultural beliefs that I just shared with you, but barriers and beliefs are unique to each family. And again, please don't say these parents are non-compliant. The why is different for each family. And you want to co-create solutions with families to discuss these individual family barriers and beliefs. So it's all about the family, and one size does not fit all. It's individualized, it's unique. Now, they may be the same across families, maybe transportation, but maybe there's something about the transportation. And now I'm going to turn this over to Jessica, who is from a Head Start program, as Donna mentioned, and she is going to talk to us about the health action plans that she has in her program. Take it away, Jessica.
Thank you. So a health action plan, you can go ahead and skip to the next slide, please. So again, health action plans, and I think it's kind of nice to know that all of us were working on this presentation separately, but when we all came together, you know, Kay and Tasha and I, we all kind of were saying the same things. And so it's nice to know that we're all kind of on the same page of And these are, I'm speaking from a Head Start perspective. So number one is cost, right? So cost, whether parents don't understand if their insurance covers it, they think maybe they have to pay out of pocket for that, or may not know of programs, things like Tasha that can help pay for those. Transportation is huge, especially right now. I noticed like in our Head Starts in our 2 counties, gas. Getting their children to school right now has been difficult. So not only taking their children to school, but in some cases it may be really expensive to take their child to an eye doctor who may not be in your county. So, we talked about sometimes traveling for that. So it may not be affordable right now for them to take them. Parent education. So just the whole understanding of what a vision screening, if a child needs a referral for that, what does that mean? What does that look like? What does that mean if a child needs glasses, or, if they have an issue? Just that parent education piece, is really big in Head Start, and just kind of helping our parents understand what that means when their child is referred for a vision exam. And then the last one is families in crisis and trauma. I know with Head Start right now, in the last couple of years, trauma informed is really huge, and really understanding where our parents are at and what is going on in their families. Something like their child needs to go get a vision exam could tip the scales on where their family is at emotionally, stability wise. So it's just really understanding where our families are at right now. The next slide, please. So a health action plan. So what is the health action plan? At ATCA Head Start, we have a health action plan, which is basically our family advocate. After a vision screening, they provide, if a child is referred, they provide a resource to parents of what is in our area. So providers that accept maybe their child's insurance, and may help with, if they're bilingual, if there's families that speak Spanish or another language that may help in that area. So we provide all of the information of, after your child has a screening, here's the form that says your child, there may be an issue. We just need further evaluation to see. And here are the resources, right? So we're giving them the chance to make the appointments on their own. And then parents we give them about 15 days, so about 2 weeks, to schedule an appointment. So we kind of noticed just in our organization that after 2 weeks, if we're not getting anywhere, it's time for us to intervene and just provide a little assistance. And after the 15 days of no updates. And so what I mean by no updates is we have, our family advocates, our teachers, whoever's bringing the children in, signing in, we're doing check-ins. Hey, how's it going? We're not pestering them, but we're just, hey, did you get a chance to call? Have you thought about it? And if we're seeing some hesitancy there, then we move on to the next step, which is parents will meet with the family advocate and or the lead center teacher or anybody in our organization to discuss any of the concerns or barriers that they have. Now, I also like to put in the lead center teachers because, as we know, some families may be more comfortable with other people in the program. It could be just an assistant teacher. It could be a teacher. It could be a family advocate. It could be me as the health manager. It could be anyone. So it's just kind of like we want to make sure that they're comfortable when we're having these discussions, so that they don't feel like attacked in any way or feel like they're doing something wrong, because this is really a support for our families. And then after we have, that meeting to discuss all of those things, the plan is written down and it's signed by both the staff and the parent and guardian with dates. Next slide. So I have a couple of examples of instances of these are actually health action plans that I have completed with families. Before I was a health manager, I was also like a site supervisor / family advocate. And so I have worked with families to help create these health action plans. And so this specific family is Spanish speaking. The dad does speak English and Spanish, but the mom is strictly Spanish. And so when the referral was given to the family, the family actually requested help from the family advocate to help making the appointment after their child was referred, because they had used our help before, and they knew that we would do everything that we can to help them navigate. So some of the barriers that they said for them is obviously just the English language fluency. Knowing this family and just where they come from. Parents are nervous about making appointments due to the immigration status that they have. The parents don't have any documentation, but their children were born here. So sometimes that can be kind of nerve-wracking for families, and they may not understand their rights as it comes to their child have Medi-Cal, which is just Medicaid in the state of California. Just understanding the rights of the insurance that their children have. And also just like the confidence in making these appointments. If you don't understand, the language very well, or just understanding just our healthcare system just in general with their insurance. So knowing how to make the appointment, knowing what they need to do next, maybe understanding what documents they need to bring to them to the appointments, like Kay was showing, like here are like some things that you do to prepare for an appointment, right? They may not know that because maybe in their country that's not how that works, but here, in the United States, it's a little bit different, and it's a little bit, more complex to understand that. So that's why we offer that help for them. And so we brainstormed solutions. They worked with the family advocate. So we can show the next slide, which is the health action plan. So this is just an example of a health action plan. It can be really simple. It can be bullet pointed. And actually this health action plan can be used for anything health-wise for children, but obviously we're talking about vision. But when we have the meeting with the families, we talk to them about what are you really concerned about? What are the barriers that you have? So, one of it is there a translator available? Like I said, that the dad spoke English and Spanish, but the mom was going too. And, she wants to understand what's happening with her child too when she goes and gets a vision exam. And, not hearing it secondhand from her husband or from the child. Which isn't fair to her. Again, navigating the health system, how that works. Are they going to have to pay a fee? Is it free? Is there a copay? All of that kind of stuff. They may not know the questions to ask when they set up the appointment or even when they're in the appointment. We all know after sometimes even our appointments afterwards, we're like, oh, I wish I would have asked that. And so during these brainstorming kind of talking about it, we can ask them, what questions do you want to ask when your child goes into this exam? And then afterwards, again, finding affordable glasses and, like the frames and the lenses. As we know, we may have places where people go to get the exam at, say, a doctor's office, but the lenses and the frames sometimes that they offer in those places, they're not affordable. And so we may help navigate and try to find ways, like Tasha was saying, that Target, Walmart, things like that may not even think, oh wow, yeah, I could go to their little place and get the lenses and the frames. And so we broke it down into little tiny steps. And so here we have the family advocate will call together with the family to make the appointment. And this is something that we do regularly. We have the family come in, we sit in the office all together, we put the phone on speaker, we call together. And so if they need us to, call and say, hi, my name is Jessica, I'm the family advocate here at Head Start. I'm here with, say the parents' names, and I'm helping them make an appointment for their child who needs a vision exam. And so that they understand that you're on the phone with them, and that you schedule that appointment. Does this work for you? All of this kind of stuff. And then you can ask some of those questions on the phone so that they feel prepared when they go to those exams. And so on there, we put due dates, right? So because all of this isn't going to happen in a day, and it can feel overwhelming. And so when you break it down by chunks, you can say, okay, we're kind of giving this a due date, and what's the completion date? So you put in there, you know, by 10/24, we're going to have you come in, because maybe it takes time for, you know, dad to get off work and come and meet you. He may not be able to do that until Wednesday. And so, you know, you figure out a time that works. Then you put the completion date, and then we have the staff sign and the parent sign. The next step is just it was decided that the family advocate is going to go to the appointment with the family to help translate. Some of our families are bilingual, or some of our family advocates are bilingual. And so we have that option. If maybe the family advocate at their center isn't available, we have other people in our organization who can help as well. So it's kind of like a team effort. If we need to find somebody, if they don't provide translators at some of their doctor's offices, we make sure that they have that. And then the last one is basically like, if the child, you know, we're thinking about it ahead of time. If glasses are prescribed, the family advocate is going to assist with obtaining the frames and lenses. So we're really starting at the beginning, what's the middle, and then how we're going to follow up at the end. And so each step of the way, we're going to meet with families. And this isn't a 30-minute meeting that we have to bring them in and everybody sits down and, you know, this can be, you know, drop off at pickup real quick just to check in. Hey, great, we made that phone call. Or hey, you know, we finished that appointment. You can take this form with you when you go to the appointment, and maybe you might need to add some things on there, or we can sign it right then and there at the appointment. Yes, we did it. That's great. You know, and then at the end, if, like I said, if glasses are prescribed, then we can help that family do that too as well. And then also, sorry, I'm going to go back really fast. I just want to, this health action plan also allows us to identify any other resources that the family might need, right? So during this, you know, I'm learning, you know, mom doesn't speak English. Does she want to learn to speak? You know, she wants to be engaged in her child's, you know, education. And it's not always fair for her to have to hear it secondhand from dad, or like I said, from the children. Does she want ESL classes? Do we have those available for mom? You know, are there any local advocates that can help in our community that can help us any of this kind of stuff too? So not only is this document, this health action plan, just used for vision, but we use it to kind of move forward to and any other resources that we can provide for the family. Okay, so the next one. This is another one of our families. And so this family is basically in crisis and trauma. This family has unstable housing. Maybe they're couch hopping from one family member to the next. They have transportation issues. You know, you never know who's going to be bringing or picking up the child. It could be grandpa, it could be grandma, it could be uncle, it could be, you know, the boyfriend, the friend, the girlfriend, whoever. It could be many different people. This family has in the past substance abuse issues. And also some mental health issues. So there's a lot of stuff going on that we understand are barriers. This family also has issues with lack of follow through, right? So there's canceled appointments and there's no shows. And as we know, with some of our clinics and our doctor's office and stuff, if they do a no show or if they keep canceling appointments, it's hard to get those appointments back. So it's our job, if we really want this vision referral to end in an exam and in a result, we have to make sure that they get to those appointments, right? Attendance issues. So not only are we going to be working on a health action plan, but this family also has an attendance improvement plan, which is that we acknowledge that this child is missing a lot of school. We've already talked about some of the barriers of why this isn't happening. And so we have that as well going on in this family. And again, different family members and friends are dropping off and picking up. So once the child had a vision referral and we needed to talk to the family about it, where's the enrolling parent that we need to talk to? Because ultimately that's the parent who that's who we need to talk to about, right? About all of this. So once we get this family, this parent in, also when we have these meetings, do we need to invite other members of the family? I know that, you know, Kay was talking about sometimes other people in the family can be a hindrance, but there's also other people in the family that can help. Do we know that grandma is a major support for this family? She's kind of the one that kind of keeps the family in line and lets them make sure that they do what they need to do, right? And if she knows, and if she's on the same page that she needs to go get an eye exam, you know, we want to involve her as well. It can be a family thing. So when you bring that family in, you know, we brainstorm solutions on who can help support you, right? Who is it this time, you know, right now, who's a support to you? Boyfriend no longer in the picture. Okay, we're taking him out. Grandma, definite support. She helps bring the child, drops off, picks up, helps take them to their appointments, helps kind of, you know, make sure that mom is doing what she needs to do. And then who can drive you there? If grandma can't do it, can we help support you? Can we take a company vehicle? Can we drive you there? You know, or are there other people in your life that can help with that? And then what ways can you remind yourself of the appointment? Do you have a calendar? Can you put it in your phone calendar? The FA can send reminders through text, just a little heads up, you know, nothing too crazy, but hey, remember, Friday's the appointment, or, you know, any of that kind of stuff. So next slide. So here is just kind of like I said, just keeping it really basic. So the first thing is just to schedule the appointment, right? So again, that can be done in our office. We can do it all together. Maybe the parent needs to go talk with grandma, and then together with grandma, they make the appointment. Finding transportation to the appointment, developing strategies to remember the appointment. Now, you know, sometimes they need help with things like that. How can we help them remember that this appointment is coming up? Like I said, do we need to send you reminders? Do we need to get you a calendar? We can print one out for you. You can put it on the fridge and just, you know, check mark off each day. Can we give you verbal reminders at drop off and pick up? Can we talk to grandma about reminding about the appointment? Is that okay? And then also is just the attend the appointment and receive a diagnosis, you know, and this could keep going on. I mean, we could do a second page, we could do a third page. This is a support plan for this family. So this again, support, right? Not punitive. We're not telling her all the things that she's doing wrong. We're just trying to identify what barriers or concerns that they may have and just identify them. Let's say them out loud. Let's write them down. Let's acknowledge them. That it's okay. You know, we can help you work through that. That's why we're here. That's why we're here for you. We're here for your family. You know, this is what a health action plan is. And I know for some families, it can seem kind of scary. You're bringing them in, we're having a meeting, we're talking about the things that you're not doing. That's not what this is. This is a positive thing. And also, you know, with Head Start, we're very strength-based. So we also want to talk about, you know, all of the things that maybe the parent is doing right. You know, you brought her to school. She got the vision screening. That's so awesome, you know. And now we need to go just move a little bit further and for the next exam. Next slide. Okay, so I had to put some pictures in from some of our centers of our vision screenings because I just think children are adorable and why not throw them in, right? So here is one of our teachers who is sitting next to a child who is a little bit hesitant to do the vision screening, you know, playing a game. And so you can see she has a smile on her face. That's her favorite teacher. She's sitting there and she's doing the screening with her. And then I love this next one, the little boy who is peeking with the eye patch. we he actually was a referral because he was having a hard time seeing with the patch and he kept lifting it up. We'd switch it back and then he'd be okay, and then we'd switch it back again. And so, as we know, if they're having some kind of hesitancy with it over their eye, it's an indication that maybe there's an issue with one of the eyes. So I thought I'd throw that in there too. The next one. And then these are just more cute kids doing vision screenings with their pirate patches on, in our centers, and how we can make it fun, how we can make it a game. What kid doesn't want to be a pirate with a patch on their eye? And I think that's it.
Thank you, Jessica. That was great. And didn't you tell me that when we were talking that this is all this health action plan is also assisting with I never can say that word, advocating skills for
Yes.
when they leave your program?
Yes.
Good.
Yes. So, like during this, some of this is just like I was saying with the first family, is like confidence is learning, with our help, because maybe they've never went to the doctor. Maybe doing those kinds of things is not normal, right? In their culture, in their families, they never went to the eye doctor. They never did any of that kind of stuff. And so navigating this, it can be kind of scary. Doctors and eye doc, it's kind of an authority figure. It's somebody who kind of stands above them and tells them, kind of sometimes things that are wrong. And that's very intimidating. And sometimes it makes them shut down. And we want them, when they go to those appointments, to, like I said, to be able to ask the questions. If we need to prepare before we go in there, write them down. Have a piece of paper. I mean, I do that sometimes when I go to the doctor, so that I don't forget, why am I coming in here? Because, some other stuff happens and you get sidetracked. But writing those things down and learning how to advocate for yourself and for your child is huge. Sometimes with the safety net of Head Start, we have so much support, right? We have resources, we have family advocates and teachers, and me as a health manager, we're all there to support. When they move on, sometimes they have to navigate those things by themselves. So if we can teach them how to advocate on behalf of themselves and their children, it's such a service to just later down the road that they have that, confidence, and they feel like they have power over their lives. Because Head Start's not just for children, right? It's not just a Head Start for children. It's Head Start as for families as a whole. How do we help them get a head start in life by providing them with the knowledge and the power, especially in health and vision?
And what I also like about that plan is it reduces overwhelm, because you're breaking it down in such teeny tiny steps.
Yep.
And I know for school nurses, this is something that you may find difficult to find time to do, but I have had school nurses say to me that sometimes they'll meet with the guidance counselor and the family and do a plan like this. Or maybe even involve the principal, just to assist that family. So thank you for that. And we'll move on now to links and resources. So we partnered with the National Association of School Nurses to create this vision page based on the 12 components of a strong vision health system of care. And the very first link is family education. So that's something you could look at. Our vision screening certification and training program, which is where I found Jessica, and she was so great to agree to assist with today. So this provides a 3-year nationally recognized certificate and 5 contact hours for professional development. It takes about 3 to 5 hours total to complete and includes a virtual skills assessment. And this is from one of our learners. She said the Prevent Blindness Children's Vision Screening Certification course is so amazing. And I hope that all schools, clinics, or any place that does vision screenings are able to get this resource and incorporate this course into their training. I have been screening vision for 8 years. I can truly say this course emphasized how critical poor vision can impact children and their behaviors as well as their learning. I work with children in Head Start, so I was reminded how critical the follow-up process for failed vision screenings are, and everything I learned from this course will definitely be incorporated into my screenings. And Donna, if you are there to talk about Zenni.
I am still here.
Yay.
Yeah, great presentation. I'm really happy to let you all know. Some of you who have been on our listserv might already know this or might have participated with very generous funding from Zenni, which is an eyeglass manufacturer. We are able to offer scholarships, full scholarships at a value of $175 for the 3-year certification, vision screening certification. And once you are certified, then you have access to vouchers, a very quick application for the full cost of a pair of eyeglasses, and you can apply over and over again. So not just for one child, but we have lots of vouchers. So the target population is probably who most of you are working with, children in underserved communities. And we list them all here: underserved minority populations, rural populations, tribal areas, immigrants, migrants, farm workers. And then here's the link. So we will also put this link in the follow-up email to you, but you can also Google Zenni Scholarship to Advance Children's Vision and get the information there. Thanks, Kay.
Thanks, Donna. Okay, call to action. Meet families where they are and do not call parents, caregivers non-compliant. Changed dentist because of that. The dentist was standing right beside of me and saying she's being non-compliant. So I'm like, okay, I'm out of here, found a new dentist. Dig deeper for the why the eye exam is not occurring. Share resources with families about the importance of good vision and scheduling and attending that follow-up eye exam when their children do not pass vision screening. And work with families to create individualized health action plans to help ensure that eye exam occurs and that treatment also occurs. You know, not just receiving a prescription for eyeglasses, but making sure the glasses are purchased with all these financial resources that you've learned about today. So that's the call to action. Now raise your hand, and I don't know if that's available to do, but raise your hand if you learned something new today. And if you found this presentation helpful, and you'll make at least one change in your vision screening follow-up process. So I'm hoping there's lots of people out there raising hands.
Yeah, I don't know if you can see, Kay, I'm the host, but lots of hands are being raised. The number keeps going up. So thank you
Yay.
all for sticking with us and indicating we're almost half the participants. Numbers are going up.
Okay. And sharing one more, we're getting down to the wire here.
Great,
so
we have lots of questions.
Oh, okay. So this is a letter. You know what? I'm going to skip this. They can read this. Let me move this. I had to learn how to move this little thing because then it messes with my mouse. Oh, I have to do this floating hot dog trick because people love this. Okay. Quickly put 2 fingers together at eye level. Look beyond your fingers, and you should already see 3 fingers. Don't look at your fingers. Just look beyond your fingers, and then pull your fingers apart about 1/2 inch, and you will see a finger like kind of floating there. Wiggle it, and I call that the floating hot dog. So just a fun little thing to do. And if you didn't see it, don't worry about it. Okay, thank you for your time and attention. Here are our email addresses if you want to contact us and your burning questions, but I'm going to go ahead of that. Again, if we don't get time to talk about this today, describe your common barriers and your cultural beliefs not discussed today, that you've worked with families and how you overcame those, so that we can add that to the information that we share. And again, I think I said question 5, but I think it's question 6 of your evaluation. So back to burning questions.
Yes, great. Thank you. I thank all the presenters. You all did a fabulous job. There's a few I thought we got a couple people asking or were things that were, I think, relevant to everyone. The first thing Ashley mentioned was that they work with a community clinic, a community health clinic. You might know them as FQHCs, that offers sliding scale fee services. And it's for low-income folks. And they have referral coordinators that can help also get people into care, and translators in communities. So I thank you, Ashley, for sharing that. I want everyone to know about that, to look up their community clinics if you're not already working with them. Tasha, here's a question for you. With the One Sight program, where can you replace glasses if they are broken with a prescription that has been within 1 year? They just wanted you to mention again the eye clinics. And is it only certain eye clinics? So I don't know if you want to expand on kind of what's encompassed in One Sight at this point.
Sure. If it's specifically for One Sight and you're looking for a replacement pair of glasses, then One Sight deals with 2 retailers, and that would be Target Optical and Lens Crafters. So in that particular situation, if the child has gotten, say, for instance, a pair of glasses through Medicaid and they broke them, then they can go to either of those retailers, which is just Target Optical and Lens Crafters. They'll be able to take that newer prescription and get them a pair of new glasses that are for a replacement. The other piece to that would be VSP. VSP also has a materials only program, and they offer the same thing. So that's a little bit more, their choices are a little bit more broader as far as providers. And in those instances, then you would look on the VSP website to find a doctor within that zip code and get a provider. So that's specifically for VSP. And the other one, again, the 2 providers are Target Optical and Lens Crafters.
Great, thank you so much. Someone had a question about the different kinds of eye care providers, ophthalmologist, optician. Kay, can you just spend a minute explaining ophthalmologist, optometrist, optician so people understand that?
So an ophthalmologist is an MD with a medical degree. You also have pediatric ophthalmologists, optometrists, ODs, and you also have pediatric optometrists. And the optician is the person who works with you with the glasses.
Right. So the optician can't write a prescription for glasses, but fills the prescriptions.
And helps make sure that and this is incredibly important, helping make sure that those glasses fit appropriately and aren't too tight or uncomfortable for the child. I'll stop now, because I don't want to take all of our time.
Right. And you can refer to ophthalmologist or optometrist. I'm going to guess for many of your communities, there's more optometrists available than ophthalmologists, and hopefully you can get in a little quicker. There's fewer ophthalmologists out there, especially pediatric. And a few people asked this, Jessica, if you're willing to share your template of the health action plan.
I definitely can. I can, I don't know how I get that out. Maybe I'll just send it to.
Yeah, send it to Kay. She'll get it to me and we will send it out. Okay.
Yep. And then you guys can alter it any way that you want, use it as an example, and then tailor it to your program's specific needs. Absolutely.
That's great. That's great. And I loved your action steps that you had in there. Maybe you could send us two, a blank one, and then one with some of the action steps that you showed,
Sure.
which is great. Thank you.
Mhm.
And then, so one person asked Natasha, this is back to you. She must be a school nurse. We get our VSP certificates through NASN. Is there another way to get these certificates?
Actually, if you have a partner with VSP, you are, NSAN is a partner of VSP. So we suggest that you get them from them. That way, whatever things you have in place as far as getting those children serviced as quickly as possible, you can continue those protocols. So yes, I would suggest that you continue to get them from that organization because they get them in bulk from VSP.
Great, thank you. And then Krista had an interesting question here. She's asking about any resources for mobile vision units that would serve schools. Several organizations have mobile vision units. Kay, do you want to just talk for a moment about those and partnering with mobile vision units?
There are several. The problem is, I don't know a lot of them right off the top of my head. So maybe if you just Google mobile vision screening clinics or mobile vision screening vans, that may help. And I know Pennsylvania has one. I won't even try to remember all of them. So try Googling, or maybe we can find some.
Yeah, you can reach out to us individually, let us know what state you're in, and we might be able to help you with that. That's a great question. And those mobile units, some of them provide full eye exams, and then some of them actually make the glasses right on site there, or can show the child the options for the frames, and then get the lenses made and then bring them back to the school. So especially if you're in an area where it's hard to find eye care, a mobile unit can be a really good option.
I just wanted to add, Donna, that even, and I don't want to be negative Nelly here, but even with the mobile vans in the parking lot at the school, sometimes there's a 50% rate of children not participating. So we still need to understand why, and that's where you may get into some cultural barriers,
right,
or cultural beliefs.
Yeah, that's a great point, that parent guardian permission is required for children to be seen in those mobile vans. So it's so it definitely helps with the issue of access to care. But in terms of actually being seen, the access only goes so far, and the permission is essential. So everything that we've talked about, and especially Jessica, is still really, really relevant. Somebody asked this great question, because Jessica works in Head Start. Are children who are not enrolled in Head Start eligible for the subsidy program? So Tasha, I know the answer, but I want you to answer it. The answer is yes. You don't have to be in Head Start. I mean, Jessica was giving examples of how she works in her Head Start program. But if you work with students and you're in a different child care program or school, or not a member of NASN, and you don't have access to VSP, Tasha, take it away.
Oh, I thought that question was for, I'm sorry, Donna, repeat that question for me, because
Are children who are not enrolled in Head Start eligible for the subsidy programs, for the vouchers? The gift certificates?
So yes, anybody who is income challenged, or the family is income challenged, they do not have to be enrolled in anything in particular to have access to the gift certificates.
Yeah, thank you. And that was a great question, because so that was important. One person mentioned that they've used their local Lions Club, and they will help with exams and glasses when needed, paying for that. And that is true. We are going to send you a multi-page fact sheet on not just the financial system programs that we run, but Tasha has put together this awesome lengthy fact sheet on all the programs that we know of out there that your families might be eligible for, in addition to the VSP in one site. And I'm pretty sure the Lions are out there. are on there as well. So there are several different kinds of programs. So I think that we have answered most of the questions. One last question that Rolanda asked was, are teachers allowed to make contact to get glasses, or does the parent have to be the one? I think you asked that before. Jessica talked about the family advocate or health manager or teacher making that call with the parents. But Jessica, do you want to take that? You know, if a parent's working and not available to come into Head Start to make that appointment together, can someone else make that appointment?
So it, you know, we do have consent to exchanges, and so maybe that would be a discussion if you had permission from the parent to make that appointment. You know, it's a partnership that you really have to have with families. You know, you have to look at it as, am I doing a disservice by just making the appointment for the family and scheduling it and doing everything for them? Because the ultimate goal is the parent education piece and them learning how to make these appointments for their children, even if they are busy. So maybe that could be part of their health action plan, which is, how can I help this parent figure out a time to make that appointment on behalf of their child? So it's kind of like, yes, we can probably do it, but is it helpful, you know?
And Donna, if I may also add, if anyone has any questions about any of the financial programs, it can be a school nurse, it could be a social worker, it can be a variety of people that can get in contact with me to assist with the financial assistance programs as well. It doesn't have to be the family. I know sometimes it can be difficult, as Jessica mentioned, for parents or families to kind of make that contact. So anyone who is in need of any of those resources can contact me directly.